So I'm very happy again today to come to share my experience and the situation about tourism and hospitality, especially the case study in Thailand. So, like currently, like I said, I have a few research on wellness tourism. Perhaps today I may be talking about wellness tourism as well, just to give you a little bit of guideline of what is the future trend about that, and also it is my expertise area. Okay. So as you may know that COVID-19 is effect all around the world. In Thailand, we are the main tourist area as well. And within our country now is, not just Thailand and in around the world are affected, but Thailand, we are doing very well in the past 11 months since the COVID-19 been affected. And we still, try to keep ourselves in the position of to regain that, but it's still hard. And recently, this month, before the end of November, the virus starting to spread a little bit more around the border. And now, we are more alert about the number. However, so we are still not alert, but we have to be careful about that. So first of the starting of the lecture, I'll just give you a little bit of brief idea that now I am around 2 hours drive from Bangkok, and I was in a hotel where we will have the guests, who's staying here. I just have a few talk with the tourists and guests in the hotel, and also I'm talking with the management of the hotel about the situation where I summarize and I want to share to you now. So, the tourist and hotel management perception, what do they think and how do they handle the situation of the COVID-19? So first of all, I interviewed the managing director of the hotel, five-star hotel, where I'm staying now. So basically, it's a five-star hotel where the room rate is quite high. The approximately $300, but now they can sell only half, and then they also have the discount. And the situation of the hotel now in general, not only in this hotel but in the other, approximately since March until July, the hotel in Thailand are closed. So they're just starting to open in July until the end of this year. So for example, the hotel where I stay now is about half an hour or 20 minutes from Pattaya. If you come to Pattaya, if you used to visit Pattaya, is one of the a destination in Thailand where people come for leisure. So the hotel where I stay, they said that the occupancy now is we have only Thai guests, Thai customer, approximately 60 to 70% occupation. No, occupancy of the room, and mainly is Thai. And when I asked the manager, they just sharing to me that nowadays the people who are booked the hotel, they are just some of them walk in, and some of them just not pre-book. So, and also one advance of the tourists in Thailand now, they go for leisure, but they not have a plan in advance. Why? Because the situation of the world and the situation of the COVID-19 affected. However, the manager in the hotel in Thailand now, they have to prepare and they have to alert more about the customer because they have more choices. For example, like a five-star hotel used to charge you about $500, but now they can sell you only $100 per room per night. Imagine like Sheraton Hotel, Four Seasons Hotel, or the five-star on the beach, beautiful beach in Samui, or even in Phuket, down south of Thailand. And now all closing. And some of you, if you used to go to the Samui Island, the main beach now, it's just like a very dangerous area, or no shop, no light. If you go there, you may be get in danger. And this is the situation. However, so in some hotel that they are open, for example, the hotel where I stay is quite near Bangkok. The hotel manager said that we still have some customer, but there are no international. and most of the guests walk in, they book by themselves. But the most important thing is now the guests, they compare between the hotel. Many five-star hotel that they can stay now, and they have dumped the price because everyone want to survive. For example, the hotel, like I said, they can't sell the full price. They give me about maybe 60% of the price that I get. The confident what they get, in the morning, like you go to the breakfast. So we have, they provide all the, you have to check temperature when you go there, and also you have to provide the glove, when the people go to touch some container or cutlery. So the guests put the glove on, and then, when they come back to eat. So everyone that walk in, they must have the mask on. If you don't have the mask on, you cannot enter into the area. Also, the hotel have a new regulation. They have to follow strictly, but they cannot do 100%. For example, I'm not sure that what it like in India, but in Thailand, if you have the guest stay, you will have to have deep cleaning. You will have to close the room at least about 1 week to be able to resell again. But in this difficulty of the hotel manager said that sometimes we won't be able to do that full house as the government suggests. However, they are still looking for the safety and security for the guests, and they have sanitizing, and especially in Thailand, we have some area being a red zone. So when the guest hotel check in, they will ask that, whether you just came from that red zone area. And if you come from the red zone area, we will have to treat them differently. And this is how the hotel manager doing that. For the service quality, they think they have to be more conscious about not to get the guest complaint, because nowadays it's like IT, they go very fast. So they're basically they try to deal with the problem in hands. And for example, I give it in here. This is the real function room in this hotel where I stay, a five-star hotel. The social distancing and space. The guests, if you're gonna get married, you cannot have guests more than 50 people. And if you have more, you're gonna have two rooms. One room you maybe have a real wedding, but the next room you will use the visualize, or you use the IT to help with that. So this is the situation right now when they have the banquet area. And in terms of the tourist perception, I also have some interview the guests in the hotel and the tourists. So basically, the trend now, they prefer local, and they prefer local, but with full facility. You're gonna have to have some basic needs, for them. For example, easy to travel, easy to travel there, and small scale of the tourist destination. They don't like crowded area anymore. The hotel where I stay far from Pattaya. Pattaya is a main destination for the world. Not many people want to go there now. They go to the second minor destination where are less people and not crowded area. They avoid the danger zone, but the guests, they still say that we still want to travel. We will not stop travel. We will not stop by the COVID-19. But this is only the guests who are already travel. But those who don't want to travel, maybe they stay at home. We didn't see them. But in the hotel now, like the end of the year, they have 70% occupancy. So it means that Thai people, they still travel, but they know what to do. Like this guy, I interviewed them this morning, I said, why are you travel? Said, well, if we know what we're going to do about how to prevent the COVID-19, so we still travel. We don't want to stay at home and to be stopped by COVID-19, but they will be aware. For example, they wear the mask on, they carry the alcohol, like hand sanitizing alcohol, and they're not going to be close with other people. Social distancing is the most important thing for them, and they will not plan in advance. The end of the year is a public holiday. They just look for the hotel. They said plenty of hotel available for them. They don't worry about no accommodation, because Thailand now we have closed country. We don't have foreign come to our country. So may I introduce a little bit about wellness tourism? It may be the future trend, and also in Thailand now, our government are focused on to develop the tourist type and activities, and one of them is a top priority is about wellness tourism, which is I expertise in the wellness tourism, which is I do a lot of project research about that. Maybe some of you never heard about the wellness tourism. What does it mean? So I give you a little bit of the definition of wellness tourism. Mean that it's a lifestyle of the oriented towards optimal health and good feeling and well-being, in which the body and mind and soul, you go to travel and you feel safe. And wellness tourism actually is active lifestyle, which you can guarantee when you go to travel, you can have a safe, and then you come back home and you don't get sick, or you not get injury in your physical. So the wellness tourism is a journey of the people who may go to travel, and you want to achieve a balance and harmony of life. Not only physical, it's including your mental, your emotional, your physical, including your spiritual. So I think this is all about the activities of the wellness tourism. In Thailand now, more and more people are get to know about wellness tourism more, but in terms of academic, maybe a less study about that. And actually, people know in terms of practical. For example, they have running, long marathon running in Thailand is become popular for the last 2 or 3 years, especially now after COVID-19. So the wellness activity are more and more organized. So how about I give you a little bit brief idea about wellness situation of the UNWTO, what they said about that. Health and well-being is impact our life, influence tourism, consumption, and WTO also say that tourists are likely to place the health and well-being as a priority. Wellness tourists, we also will motivate by seeking physical, mental, and spiritual health well-being. It's not only Thailand now, but it already been 2 years that UNWTO had been stated about that. But nowadays, even more important about the wellness tourism. In Thailand now, the government, for example, like TAT, or we call the Tourism Authority of Thailand, they also try to make the tourists are confident about travel again. So we have so many campaigns coming up about the travel, including we have called CHA, safety. Thailand tourism is needed. So we need to have some certificate. Like in here, Thailand Tourism Authority said SHA or SHA is come from Safety Healthy Administration. So we rebuilt tourism after the COVID-19. So Thailand Authority and Ministry of Sport and Tourism are seeing as that very important. What we have to do about that in Thailand. So SHA is about safety, attraction, and facility. And we will have some regulation about to get this certificate. Many organizations like hotel tourism, if you open the service industry for the tourists, if you have are very confident that about cleanliness, about health, well-being. So this is a certificate where the TAT are launched to the service industry. For example, here we have the restaurant and the hotel accommodation, recreation activities, also including in the public transport, travel agency, especially spa. As you may know that in Thailand, spa very famous, especially Thai massage. We have a lot of guests, especially overseas, international, like to use facility. But now spa seem to be major affected, and the people don't feel confident to do that. But TAT that launched the certificate that if you have SHA certificate that you can confident to come to use the facility again. However, it's still not recovered yet from the being aware about the COVID-19. However, we try to get there, but we have to help each other. Also in the department store, in the sport tourism, the activity and events, nowadays we have stopped the event. And for example, we have marathon running for health. It just starting last 2 months, but before that we're not allowed to do that. But now it's starting to have sport for health, for example, marathon for health, the way that we carry on the event also changed. I also the runner myself. I run the half marathon, and I found that strictly about safety and security for health and COVID-19 are put in place so seriously. So this is some of the, okay, I give you some example. Before COVID-19, I'm done the survey. I'm doing about tourist behavior. What do they think about the spa? You know, what the behavior of each nationality in terms of using spa in Thailand. But this is before COVID-19. I like to share with you that I went to Samui Island, and then I interviewed the spa manager, and I'm talk about them. You know, what is the behavior of the tourists, and perhaps when I thinking about now, it's not different. The behavior of the spa tourists not different from now when the situation of the COVID-19. I give you one example. I talked with the hotel manager, about 25 of them, and those who have experience with the Indian tourists, you know, before that COVID-19, the Indian came to Thailand. Most of them are middle age, and their age approximately 25 to 40 years. And most of them come as tourists often plan their own trip. They come with a group, and some of them come here for wedding, and some of them come here as with the travel agency. The time that the Indian tourists to stay in Thailand before COVID-19 is about 7 days, and not over 2 weeks. And the most they like in Thailand is about Thai massage, and they go to the spa sometime, you know, but they like to be to experience about Thai massage, where it's very unique about that. Okay. I will maybe skip. Let me know if my time is up. Okay. So I don't need to go over the time. We have some Chinese behavior, you know, I won't go through that, but I can share this PowerPoint to you. But what I want to say is I just want to talk about the development of spa tourism, and perhaps this model can be used in the after COVID-19 as well. Even though this model is just coming out just before COVID-19, in my opinion, this model can be applied to use in as a wellness tourism, including a sport or spa, or perhaps the other activities about wellness. So we basically we considering about the 4P, you know, like planning, like product and service, and position and promotion of the product that you want to develop. You know, we have planning, we have decision making for the tourists, how they plan and how they come. Usually the people before they come, they have planned in advance, which is consider about the planning. They also see about what is will be in the destination, and then they have half planning, and which is, you know, this is matched with the tourist behavior when I talking to them during COVID-19. So they just have planning, and the rest of that they will see what happening. So this model plan is about the assets, internal and external environment as well. And I'm sure that many tourists want to come to Thailand, but as nowadays we are closed, but we should be try to apply this model within your country, rather than you waiting for your international guests. And in Thailand are now the same. Or most of the management, most of the travel agent now, they don't do international anymore. They can't rely on international. So this model, how can this model apply and attract more domestic tourists? And you know what? I share another experience. We have the hotel now, they sell the package to the domestic tourists. And we have more domestic tourists travel for wellness. For example, when they travel, they have take a time between 3 days to 7 days. And the activity they're doing, they want to do yoga, you know, they want to do running, they want to do a short running, a sport. And they also like to go to have healthy food. And I think I'm sure that in India also have a lot of healthy food compared to Thailand. I think we have the same, you know, like ingredient or something like that. India are more stronger and unique food than Thailand. So one thing that I do from my research, I call slow food tourism. I'm not sure that you ever heard about that. Slow food tourism is defined as good, clean, and fair. Good is mean that to produce a maximizing its favor connection to a geography and cultural region. Clean food, to produce in the society with a sustainable way to preserve rather than destroy the environment. Fair food is mean that you produce in sustainable way, in social justice and in the fair wages. And this is what in Thailand we start to have. So maybe new for you or maybe new for someone never heard about that. In Thailand, we have the market called the slow food or farmer market. And this is one of the situation in Thailand, So north of Thailand, this is the market where we have slow food or we call healthy food. So you can go to eat local food, but most of them is ingredient are made from organic food. And also people starting to know about health, well-being food, and people who are selling this also alert about the tourists starting
Professor,
interested about that. Yeah.
Professor, I thought you will take a little more time.
Okay. So
So what I do is we will again. I'm going to start the discussion session, but
okay, sure.
you may keep continue your presentation. We will shortcut the discussion session so
Okay.
that your presentation will be completed and students also very
Oh,
easily
okay.
it can be
All right.
understand.
All right.
Right?
Thank you. I think after.
Please join with discussion session meeting code and passcode.
All right.